Hello everyone, I'm Dr. Neha Gupta from Mediworld Fertility. Today we will talk about embryo glue. So we have a lot of patients who come to our OPD and who want to discuss that they have landed up with previous IVF failures and they were suggested to use embryo glue. Now, is it like a magical glue by which we can implant your embryo by sticking it to the uterus? No. So embryo glue is just a media which is used while we transfer the embryo. It is little viscous, little thick, that is why it is called as embryo glue. But actually it does not stick the embryo to the uterus. There are some studies to say that in cases of previous implantation failures, if we use this media, then maybe the embryo retention is not there and the success rate is better. But then with larger RCTs, when the larger trials have happened, we have realized that none of the RCTs is recommending the routine use of embryo glue. It can be used in certain specific situations, like where we have previous implantation failures, or in cases where the embryos have been retained, or where we feel, according to our clinical judgment, that this media might be useful for you. But routine use of embryo glue is not going to improve your implantation rate. It's not a magical thing. It is not really a glue. It is just a misnomer. So please do not go by the brand name of this product. Discuss with your doctor, do you really need it? How beneficial is it? Do they recommend? What do the studies say? What do the embryologists say? What is your experience regarding the glue? In my experience, I would like to say that it's not a magic thing, but yes, we want to use it in certain conditions where we feel that it might be beneficial for the patient. So discuss the pros and cons, and then you can opt for this embryo glue. Thank you so much.